my name is Osmel Garcia, and today I would like to talk about phlebotomy or venipuncture procedures. Most of the patients are afraid of phlebotomy procedures. That's why it is important to have an ethic and well-trained staff in the places where these are performed. You need to be certified to practice venipuncture, like doctors, nurses, medical assistants, nursing assistants, and of course, phlebotomists. The first step is to gather the materials you will need. You need safety needles, like this one here, syringes or butterfly needles, this one is much better, blood collection containers or tubes, this, tourniquets, antiseptic, in this case we use alcohol, gauze or cotton balls if you don't have the gauze, sharp disposal container, and bandages or tape. Once you have all the materials, you need to identify the patient. It is important that you will draw the right patient. Really important. Reassure the patient that the minimum amount of blood required for testing will be drawn. Wash your hands and put on gloves. Mine are already washed. Select the appropriate vein for venipuncture. Usually we use the veins from the elbow or from the back of the hand. These are the best and they are not as painful as the ones on your hands. Now apply the tourniquet for 3 to 5 minutes and 3 inches above the collection site. I'll show you. I'm gonna try to do this myself. Okay, so we place the tourniquet. In this case, I want to draw some blood from the elbow. I'm sorry, but I couldn't find any volunteer for this today. So it's going to be me. Okay, now the tourniquet is on. Okay, it's placed. This is the vein that we will use today. This is the cephalic vein. Okay, like I said, after you have selected the vein, you need to sterilize the vein with alcohol. Okay, good. Let it dry by itself. Don't touch the area that you are gonna draw. I'm gonna use a butterfly needle, this one here. It has the needle here, and this is the container. And we will use this kind of lavender tube with, we are gonna try to fill it up with blood. Okay. We take the top up from the needle, and then I'm gonna draw some blood here. As you see, this is really easy. It's not painful at all. Now take the tube, insert the tube in this container, and you will see how the blood is coming out. Really easy. I don't know if you can see it there. Yeah. Okay. Once it is stopped and the tube is filled up, take the tube out Then take the tourniquet out, take the gauze, and release the needle like this. Really easy. In this case, the needle goes inside the plastic. See, no needle here, no dangerous. Then you can dispose this one on the sharp container. Okay, so I'm gonna apply the tape, and as you can see, this is really easy. I did it myself. Tourniquet out, and you can see the blood here. This is really easy once you get used to it. Usually we fill up several tubes, like this one here is for chemistry, and this one is for cells. Don't be afraid. Okay, after you're done with the last tube, release the tourniquet like I said, remove the needle, make some pressure for several seconds, and put over the tape. All of this is done. Dispose the needle in the appropriate container and start labeling the blood. You need to label the blood with the patient's name, date of birth, current date, and your initials. Okay, after all of this is done, thanks the patient and send the blood to the lab to be processed. As you can see, these procedures are not difficult once you get some practice. Always treat the patient with respect and most important, love what you are doing. Thank you all for your attention.